I'm Richard Roberts. I'm a professor of family medicine at the University of Wisconsin, but I've spent my entire career practicing in rural communities. When I first completed my postgraduate training, I was in a community of 2,300 people, and that felt a little too big. So now I'm in a community of 1,900 people, and I've been practicing in the same rural location for about 28 and a half years. It's been my great honor and pleasure to have families where I sometimes have five generations in the same family that I'm looking after. And stopped doing deliveries and hospital care about 2 or 3 years ago because I was traveling around the world so much as president of the World Organization of Family Doctors, and I grieve that a little bit, but I'm still doing most everything else. Certainly have a busy, very busy ambulatory practice. Well, one of the great joys of my professional career has been the chance to visit so many countries and to watch healthcare in action, both from the highest levels, the presidents, prime ministers, health ministers, all the way down to the ground level where people were sometimes in very remote settings, working under extremely difficult conditions. And one of the conclusions I came to is that all of the health systems around the world are struggling. We're struggling with aging populations, with the growing cost of care, with the fact that many times things that we as health professionals might do for folks really don't have the evidence basis that we'd like to have, and that sometimes we do more harm than good. And yet my fervent belief is that it's going to be rural health care that's going to see us through, that's actually going to show us the way forward. And the reason I believe that is that healthcare at the end of the day is about people. It's about knowing people. It's about developing trusted therapeutic healing relationships. And I think we've been able to hang on to that tradition better in rural communities than I see among my urban counterparts, who sometimes get a little too easily captivated with the technology and the specialism, and it's all about the science, when in fact the science is really not very good. And so it still comes down to knowing the person as being more important than knowing the disease. And to me, the rural health professionals are best positioned to kind of remind the world of that, and to show our ability to really not only engage patients, but to have dramatic impact across communities, because we just think that way, and that's how we do our work. So I'm really excited about the chance to pay another visit to Adelaide, to catch up with many of my Aussie friends, and to learn from you the exciting things that you're doing in rural healthcare, and to perhaps share a couple of ideas that I hope you'll find interesting and perhaps even provocative.